Good afternoon and welcome to OSHA Consultation's COVID-19 regulation update. My name is Dan Leiner. I'm an area manager out of our San Fernando Valley consultation office. And I'm going to be joined today by Carmen Cisneros, who's also an area manager out of our San Diego consultation office. I'd like to welcome everyone. What we're going to be doing today is covering really the updates to the regulation. We're not going to cover the entire COVID-19 series of regulations. That would take us about 4 hours. We're going to just hit the highlights of the updates, what the major changes were that were adopted on June 17th. This update is fairly new. It seems fairly straightforward. We're not allowed to interpret make interpretations. So we do have a lot of information on our website, and what we plan to do is towards the end of our webinar, go to our webpage and show you where to find some of this information. I also want to let people know that if you're within the healthcare industry, your industry, depending on what you do in healthcare, you might fall under our aerosol transmissible diseases regulation, also known as ATD, section 5199. It also applies to industries such as jails and prisons and people who work with high-risk populations of exposure to airborne diseases, including homeless shelters, drug rehabilitation facilities, things like that. And that regulation, the aerosol transmissible disease regulation, will apply to those workers that have occupational exposure to aerosol transmissible diseases under the regulation. And for your workers who do not fall under the aerosol transmissible diseases standard, they're going to fall under these COVID-19 regulations to protect them. The other thing I want to mention is federal OSHA adopted an emergency temporary standard for COVID-19 for the healthcare industry. But I want to let you know, we already have that aerosol transmissible diseases standard, and you should continue to follow the aerosol transmissible diseases regulation. Our headquarters is doing a side-by-side comparison of the federal emergency standard to our existing standard for aerosol transmissible diseases, and I'm sure that the differences will get posted on our website fairly soon. What we're going to do today is, like I said, we're going to go through as much the material and hit the highlights. We're going to go over why this regulation was revised, a quick overview of the history of the regulation, and then we're going to spend most of the time focusing on the recent changes that were adopted on June 17th. And then we're going to go over some of our frequently asked questions, which are actually found on our website. I want to let people know that this presentation is current as of June 21st. So all the information is current as of last week. But it's important that employers keep up to date, not just with COVID regulations, but with all regulations that might apply to them. So it's in California, it's the employer's responsibility to make sure that you're familiar with regulations, stay up to date with changes or adoptions to new regulations. And you can do that by checking our standards board webpage periodically, or by calling a consultation office and talking with a consultant and let them just ask and say, hey, I work in this industry. Are there any updates or changes in the last few months that I need to be aware of? Today, we're going to have Carmen Cisneros and myself present. Carmen is, like I said, is an area manager out of our San Diego consultation office. She's been with a manager with consultation for about 8 years. Prior to coming to consultation, Carmen worked through the enforcement part of OSHA, and before starting with OSHA, worked in the workers' comp industry. I have been with OSHA consultation for over 27 years. Before coming to consultation, I worked in the aerospace industry and on a project in Los Angeles County doing outreach to lead-using industries. In the background today, in our chat room, Zora Ali has been with us for all of our webinars, including the ones we did before this that really covered the full regulation before the update. But in addition to Zora, we have Ray Acree, who is an area manager with our San Bernardino consultation office. We have Zora, who is a senior industrial hygienist based out of our La Palma office. We have Patrick Corcoran, who's also a senior industrial hygienist who is based out of our Sacramento office. We've got Stuart Migdal, who's one of our safety and health consultants based out of our San Diego office. And we have Tara Curl, who is also a consultant based out of our Sacramento office. So let's talk about why this regulation was revised. Mainly because vaccinations are now available. When this original regulation was adopted in at the end of November of 2020, the original regulation had no mention of vaccines at all, at any place within the regulation. And it was around that time that vaccines were just becoming available for the public. So this revision now reflects, we're now 6 months into people being vaccinated. So it was time to update the regulation to address people who are vaccinated. CDC and the California Department of Public Health updated their face covering guidance. So Cal OSHA needed to update our regulation to address the face covering guidance that was put out by the CDC and California Department of Public Health for vaccinated workers. And what this revision does also, it provides options for employers to make a safe transition back to more normal operations. By this update completely removed the physical distancing element. Now, there are still times that physical distancing may be required, but in general, physical distancing has been removed. So has the requirement for physical barriers, but we're going to talk about where you might want to still keep physical barriers as a best practice right now. And then they updated the face covering requirements, again, for more normal day-to-day operations. So this regulation was originally adopted as an emergency temporary standard. What Cal OSHA does is we submit a draft, a version of the regulation to our Occupational Safety and Health Standards Board for them to vote on. The regulation, the draft regulation was posted on the Standards Board website for the public to review before their November board meeting. And at their November 19th board meeting, they voted and approved the regulation. The next day, the final step of the adoption of a regulation is the review by the Office of Administrative Law. So on November 19th, the board voted to approve the regulation. It was transmitted to the Office of Administrative Law the next day. Because this was an emergency temporary standard, the Office of Administrative Law has a 10-day period whether to approve the regulation or send it back for some changes. They made the approval on November 30th of 2020. And because it was an emergency regulation, it became effective immediately upon the Office of Administrative Law approval. And again, just a quick reminder for the employers that fell under our aerosol transmissible diseases regulation, that ATD regulation, that regulation applied to those with occupational exposure. These regulations apply to everyone else. Before November 30th, Cal OSHA was addressing COVID-19 in the workplace using existing regulations. They were using the Injury and Illness Prevention Program and other existing regulations to address worker safety prior to the adoption of the emergency temporary standard. So in May of this year, we realized the regulation needed to be updated because people were getting vaccinated. And Cal OSHA developed an update. It got posted before the May Standards Board meeting for public review. And then after it got posted, CDC made changes to the face covering requirements to relax requirements for vaccinated workers. So Cal OSHA asked the board not to vote on the changes So we had a chance to address the CDC changes regarding face coverings. So the board agreed not to vote on the standard and agreed to hold an emergency board meeting on June 3rd with the revised standard. And what ended up happening, that after some public comment, they initially voted against the proposed changes, but then they realized if we reject this, we're still stuck with the original more stringent regulation where everyone has to wear face coverings and physically distance. So they held a second vote, and at the second vote, they voted to adopt the changes. And then they submitted the changes to the Office of Administrative Law. Then on June 9th, they held another emergency board meeting, and they voted at that meeting to withdraw the most recent update from the Office of Administrative Law, because at that point, the draft language did not align with the governor's reopening plan, because the governor's been talking about reopening the state on June 15th. So they voted to withdraw approval by Office of Administrative Law, and then Cal OSHA made another update to more align the changes to the regulation to align with the governor's reopening plan. They posted it on the website for the board's June meeting, and the board voted to accept the regulation. They basically approved the regulation on June 17th, and rather than waiting for the up to 10 days for the Office of Administrative Law to do the final review, the governor issued an executive order that allowed the updates to go into effect the same day. Otherwise, workers would have had to continue to wear face coverings and physically distance for up to an additional 10 days. So it was a long, complex process. I've never seen anything like this before in my history with Cal OSHA, but workers only had to wear face coverings for an extra couple days because of the governor's executive order. Now, we had 5 regulations that were adopted in November, and these are the 5. Section 3205 is the main COVID-19 prevention regulation. That is the section that has the scope and application, definitions, and has the requirement for a written COVID-19 prevention program. Then the remaining sections, point 1, point 2, point 3, and point 4, point 1 and point 2 deal with outbreaks in the workplace. Point 1 deals with minor outbreaks of 3 or more cases, and point 2 deals with major outbreaks of 20 or more cases. And then point 3 and point 4 were really developed initially for employers who have workers in the United States under a special visa program, the H-2A or H-2B visa programs, which are typically found in agriculture and food processing facilities where there's a lot of seasonal work. So, and under those visa programs, employers are required to provide transportation to and from the housing to the job site, and they are required to provide housing to those workers. So 3205.3 covered employer provided housing. 3205 initially was for employer provided transportation to and from work. But when this regulation was updated on June 17th, you notice those last 4 words are gone, the to and from work. That section now applies to all employer provided transportation. So if you have workers going from job site to job site to job site in the same day, this section will apply to you. So just, I want to let people know that, because a lot of people think, oh, when they get to the employer provided housing, that doesn't apply to them. We can drop off the webinar. Definitely, if you have employer provided transportation, stick around. We're only going to talk about that housing part for a couple minutes. I want to also let people know right up front, we have a lot of resources on our website. The first link is a link to our the actual regulation. This version of the regulation is easy to read because it has strike through and underline. It's the original November regulation. And what they did, anything with strike through, anything with a line through the words is being removed from the original regulation, and anything with underline is being added, is new, completely new. So this is a great document to review to see what actually changed versus reading the regulation and trying to figure out what changed. The second link is to our COVID-19 sample written program. I want to let you know right up front, Cal OSHA is working on an updated written program. What's posted, I checked about 15 minutes before the start of the webinar, and right now the December 1st version of the sample program is still posted on our website. So it does the sample program on our website does not reflect the recent changes. At internal training that we had last week, they said the updated program should be posted by early this week. And so what I'm telling employers to do is just keep checking this website periodically to see when it gets posted. One nice thing is they post the date when the program was posted on the website, so you'll know when the new version gets posted. The other thing is for the written programs, they're available in Spanish and English. And if you click on the language, as soon as you click on it, it will open up a Word document that you can then save to your computer and tailor it to your company's policies and procedures. The other important links are the FAQs, or frequently asked questions. Our original FAQs that were questions answering the original regulation were updated to reflect the recent changes. So the first link is to the original FAQs. The second link is questions and answers specifically to the revision. So there's some good resources right there, and that's where we go a lot of times to find the answers to questions. Just real fast, I want to talk about the main changes. The main changes are people who are fully vaccinated and that are not having symptoms no longer need to be tested or quarantined after a close contact with somebody who's had COVID-19 or who's having symptoms or has tested positive. They totally eliminated face covering requirements for workers who are working outdoors, regardless of vaccination status. Now, I would still encourage workers to maintain some physical distancing if it's feasible, but they're no longer required except during an outbreak. If you're having an outbreak, face coverings become required again for people working outdoors. People who are fully vaccinated no longer need to wear face coverings indoors, but unvaccinated workers will still need to wear a face covering. And employers are going to be required, and they have to document their workers' vaccination status. And before you start asking a ton of questions, we are going to talk about this more later on, how you definitely have a legal right to ask for vaccination status. It's not a violation of HIPAA regulations. And on our website, we actually have 3 methods that you can use, one or all of the methods of how to document. And we're going to go over that a little later. Employers need to make sure that unvaccinated workers wear a face covering, and a face covering now includes N95 respirators under voluntary use. And we're going to talk about what the requirements are under voluntary use regarding things like fit testing, medical evaluations, training. We'll talk about that a little later. But they have to wear face coverings when indoors, or if they're in a vehicle with other people. They need to wear a face covering, and the use of an N95 is upon request, and we really will encourage, you should be encouraging your unvaccinated workers to ask for an N95 versus wearing a regular face covering. And we'll tell you again why that is in a little bit. Employers cannot retaliate against employees from wearing a face covering, again, for unvaccinated workers. And vaccinated workers have a right to wear a face covering even if they're vaccinated. And employers cannot retaliate against that. And in fact, recently, the World Health Organization and today, Los Angeles County Health Department really again went back to encouraging everyone to wear a face covering indoors because of the Delta variant that's been going around California. That is even more contagious. And then I've heard about the Delta Plus variant that's been in Asia that will most likely make its way to the United States as well. So it's still a good idea to wear face coverings. And as an employer, you can still require face coverings, even though Cal OSHA has relaxed the requirements. Our requirements are minimum requirements. You can be more stringent. So the physical distancing part is gone. The physical barriers are gone. Again, there are some exceptions to that, and mainly for outbreaks. But if you have physical barriers, we really recommend keeping them up for right now. And if you do take them down, don't just throw them out, because if things get bad again in the future, you may need to bring them back and reinstall them. And if you've already made the investment, have them in place, you might as well keep them up a while longer, especially if you're in an industry that works with the public, where you're kind of relying on the person being honest about their vaccination status if they're unmasked. And especially if you're a place like Target or Walmart or Sam's Club or Costco, someplace where you're having a lot of interaction as a cashier, where you're seeing many clients or customers in an hour period throughout your workday, it's still a good idea to keep the barrier, in fact, having them continue to wear a face covering for their protection. For housing, they've eliminated the physical distancing requirements again. And housing, if everyone is vaccinated, that whole section does not apply. However, if you have one person who's unvaccinated in the housing, the regulation will apply. And then in all workplaces, if you have mechanical ventilation systems, the systems need to be adjusted to maximize the amount of outdoor air brought into the workplace. So bringing in more fresh air for more dilution and increasing the filter efficiency. In the certain parts of the regulation, it addresses what level filter, but if you cannot, your system is not designed to handle that level of filtration, you want to look at increasing the filtering efficiency to what your system is designed to handle, and then evaluate the need for bringing in additional air cleaning systems, such as the kind you can get for a home filtration system with HEPA filters. They have really large units available for larger work facilities that you can use those to filter the air. And that might be applicable also if your building does not have a mechanical ventilation system to help keep the air clean. I also want to let people know there are requirements from the original emergency temporary standard that was adopted in November of last year that remain in place. You're still going to have a written COVID-19 prevention program. You're going to have to update it, and I recommend waiting until our sample program gets posted to update it. And then once you have that, you can probably copy and paste from your old document into the new one and make the changes to reflect the recent updates. You're still going to have to provide effective training and instruction to your workers. And there were some new additions that need to be conveyed to your employees. So you're going to have to do some additional training. You're still going to have to notify the local health department if you have an outbreak at your facility. You're still going to have to notify your workers if they have an exposure and close contact to a COVID-19 case in the workplace. You're still going to have to offer testing if your workers have potential exposure. So there's still the requirements of what you need to do to respond to a COVID-19 case in your workplace, or if you have an outbreak. The quarantine, you may still have to quarantine workers, and you may still have to address exclusion pay. And then there were some changes that you're still going to have to do to address requirements for employer-provided housing, and then for all employer-provided transportation. So we're going to be talking about those as well. So the scope of the regulation is who this applies to. And this section applies to all places of employment, except when there's one worker, if an employee is working from home. And when you see a slide like this, it has a lot of words that are not underlined. But the part that's not underlined is in the existing regulation. And what's underlined is what the change is. So they added to this regulation the scope. Employees with occupational exposure is defined by section 5199, which is the aerosol transmissible diseases regulation, when they're covered by that regulation. For the people without occupational exposure, or for workers that have occupational exposure, but they might be doing something that they don't fall under the regulation, that the ATD regulation, they're going to fall under the COVID regulations. And they did add that workers who are teleworking, that the telework location is at the employee's choice. It's not under the control of the employer. If you tell them, your workers who are teleworking, where they have to work from, they will fall under the regulation. They've changed some of the definitions and added some definitions. We had a definition for COVID-19 exposure. They changed the name of that to a close contact. And that just means a worker who's been within 6 feet of a COVID-19 case for a total of 15 minutes or more within a 24-hour period, within or overlapping with the high-risk exposure period. And the high-risk exposure period is the time that they're contagious. And they added this part at the bottom that there's an exception for close contact if the employees will not have had a close contact if they were wearing a respirator that is required by the employer and used in compliance with section 5144, which is our respiratory protection regulation, when they were within 6 feet of the case during the high risk exposure period. And there are a couple places when we refer to respirators in this regulation, in this update, where the regulation will clearly say it's used voluntarily versus required by the employer. And when it says required by the employer, that means employers require respiratory protection and they will need to have a fully implemented respiratory protection program in accordance with section 5144. And we'll discuss more of that a little later. They've added one thing to the COVID-19 case, which is again, somebody who tested positive. It was somebody who may have had symptoms, but never got tested. So they were ordered to isolate by the local health department. And they added to this update someone who's had a COVID-19 diagnosis from a licensed healthcare provider. So they may not have been tested, but the doctor has determined that they have COVID, and that most likely will be based on their symptoms. They added definition for exposed group. And for this section, you'll see nothing underlined. And in fact, the next slide continues with the exposed group. This, when you see nothing underlined, this is a new section, so all of it would be underlined, it would all be new. So I thought the underlines would be distracting, so I didn't include them. So an exposed group is all employees at a work location, work area, or common area where a COVID-19 case was present at any time during the high risk exposure period. This had a different definition before, like an exposed workplace, or I think it was exposed workplace. So this makes it more clear. When people saw exposed workplace, people thought everyone who worked inside the building was, the workplace. And that was never the intent. The intent was the people who worked together. So if you're a manufacturing facility, a shipping and receiving department, typically, and you've got a warehousing area, you've got your production area, you've got office administrative area. So if you had cases, if you had an outbreak happening in your shipping and receiving area, that was the exposed workplace. So this now just makes it a little bit more clear that your exposed group is the common area where people are working together and you're having an outbreak among the people within that area. So if you had 2 cases in shipping and receiving, and 1 case in the office and one case in production, you didn't meet that 3 or more threshold because the group wasn't necessarily working together. They have work in different areas, they work in different areas and not necessarily interact. They have some exceptions to this. Again, if somebody is walking through an area quickly, and they're wearing a face covering, we're not going to count that. That is if they're not congregating. So people around a time clock would be congregating around the time clock, but a worker who's just kind of passing through other areas, going from their workstation to a restroom or walking to a break area to take their break, where they momentarily pass through the area, is not considered part of the exposed group. And the next one, again, the way it's worded is a little confusing. If the COVID-19 case was part of a distinct group of employees who are not present at the worksite at the same time, that other people are not part of the group. And that mainly is for shifts. If you operate different work shifts in the same department, if you have a day shift and a swing shift, as long as there's no overlap. If your day shift ends at 3 and your swing shift starts at 3, those are separate crews. So even though they work in the same area, it doesn't mean they had exposure because the COVID-19 case wasn't there during their work shifts. And again, if the COVID-19 case was wearing a face covering during the entire visit, the people who are around them are not going to be considered exposed. So just be aware, an exposed group may include employees of more than one employer, and that's especially important if you have temporary employees. And this definition of an exposed group really applies to when you have an outbreak, so a minor or major outbreak. They made an update to the definition of face covering. And so it includes now a surgical mask, a medical procedure mask, a respirator worn voluntarily. And when we talk about respirators, that can include elastomeric respirators, but most often it's going to be a filtering face piece or a dust mask, such as an N95, or a tightly woven fabric or non-woven material. They did add of at least 2 layers. So they clarified the requirements of the thickness or the double layered face it has to be at least 2 layers to be considered a face covering. It can have no visible holes or openings. That's part of the old definition. And it used to say and should cover the nose and mouth. It now says must cover the nose and mouth. So if you have a worker who's not wearing their required face covering, if they wear it improperly and only cover their mouth and not their nose, that is a violation of the regulations and you can get cited for that. And if you have a worker who's not wearing them properly, you're going to go back to your injury and illness prevention program, your IIPP, and you may need to start disciplining workers in accordance with your disciplinary procedures as part of your program. They also added a face covering does not include a scarf, a ski mask, a balaclava, bandana, turtleneck, a collar, or a single layer of fabric. So they've added some very specific requirements to this regulation and have excluded certain things from being considered face coverings. They added a definition of fully vaccinated, which is somebody that's been at least 14 days since they had their second dose of a 2-dose vaccine series, or 14 days after their single dose vaccine. The vaccines need to be FDA approved, have emergency use authorization from the FDA, or for somebody who's been vaccinated outside the United States, the vaccination is going to be considered acceptable if that vaccine is listed on the World Health Organization's list of vaccines for emergency use. They added the definition of a respirator, which is a protective device approved by the National Institute for Occupational Safety and Health, also known as NIOSH, to protect workers from particulate matter, such as N95 filtering face piece respirators. And this question comes up a lot in every webinar. What about KN95s? KN is an Asian version of approval. And in the United States, respirators have to be approved by NIOSH. KN95s are not approved by NIOSH. There may be a few that have been approved by NIOSH, but the majority of them have not. The majority do not filter as they're designed to filter. And CDC has estimated that about 60% of KN95s are actually counterfeits. So they're actually not good as a respirator, but they can be used as a face cover. They're totally acceptable as a face cover. And they added a definition for worksite. And again, it's to clarify where, if you have an outbreak or, for the purpose of the regulation of where the COVID-19 case is exposing people. So if you're in a high-rise building and operate multiple floors, it doesn't mean all of your occupied floors are the work site. It means we're again focusing on the particular area where that case was. If you're a facility that has multiple buildings on the same property, it doesn't apply to all of your buildings. It applies mainly for an outbreak or the cases that are occurring in a particular facility, building within your property. Now we're going to get into the COVID-19 prevention plan, the elements of the plan. Before this recent update, it had 11 elements, and what's missing right now that was totally removed is the physical distancing element. And we'll be talking about where physical distancing is still required, but at this point, I'm going to let Carmen take over and cover parts of the COVID-19 prevention plan. So Carmen, go ahead.
Thank you, Dan. So now we're going to talk about 3205C, which is the section on written COVID-19 prevention program. And the new language still requires all employers to establish, implement, and maintain an effective written COVID-19 prevention program. So you still have to maintain this, and you may maintain it in a separate document or include it as part of your injury and illness prevention program. We're going to go into the different elements, but we're only going to cover the changes. We're not going to cover all the information. So as Dan indicated, physical distancing was removed, but let's go ahead and get started into some of the changes. So we're going to the next screen, and we're going into the section on identification and evaluation of COVID-19 hazards. And this section still requires employers to develop and implement a process for screening employees for and responding to employees with COVID-19 symptoms. Now, what it has done, though, it has included additional information. And here now the employer is required to conduct screening. And if doing screening indoors at the workplace, the employers shall ensure that face coverings are used during screening by both screeners and employees who are not fully vaccinated. So this underlined language has been included, the vaccination, who are not fully vaccinated, and if temperatures are measured, that non-contact thermometers are used. So it's indoors and who are not fully vaccinated. Now for indoor locations, what it requires is that the employers have to evaluate the ventilation and evaluate how to maximize ventilation with outdoor air to the highest level of filtration efficiency compatible with your existing ventilation system. And they have added, and whether the use of portable or mounted high efficiency particulate air, HEPA filtration units, or other air cleaning systems would reduce the risk of COVID-19 transmission. And if you go further into the identification and evaluation of hazards under section F, it addresses information that was already included, which indicates that employers shall review applicable orders and guidance from the state of California and other local health departments related to COVID-19. But it has also added these orders and guidance are both information of general application, and it references interim guidance for ventilation, filtration, and air quality in indoor environments by the California Department of Public Health. And this interim guidance, we have it on our website. So towards the end of the presentation, we will show you where you could find this information. Basically, you have to communicate with the people in charge of your heating, ventilation, air conditioning system unit and see how you could meet these requirements. And we're going to talk about this further when we address the outbreak sections. Next, we go into investigation and responding to COVID-19. And here, within 1 business day, the employer has to provide information to any other employers of any COVID-19 case. So here, within 1 business day of the time the employer knew or should have known of a COVID-19 case, the employer shall give written notice in a form that's readily understandable by employees that people at the worksite may have been exposed to COVID-19. And here they have provided some clarification, because prior to last week, with the original language from November 30th, it was unclear how do I provide this notification to employees? Do I do it by text, email? What do I do? So now it's giving that clarification. Written notice may include, but is not limited to personal service, email, or text message if it can reasonably be anticipated to be received by the employee within 1 business day of sending. And the notice shall include the disinfection plan, which is required by 6409.6. Now here it also says who you're supposed to provide this information to. It must be provided to all employees at the work site during the high-risk exposure period. So here we have one of those definitions that Dan discussed. And you also have to provide it to independent contractors and other employers at the worksite during the high-risk exposure period. So if you're a secondary employer under the dual employer, in other words, you have temporary employees, you also have to provide notification to them. This is why it is very important that you know who's coming in and out of your workplace, and as Dan indicated, even from the different departments, because if anybody was exposed, then you have to provide this information or notice to the employees. You also have to make COVID-19 testing available at no cost during paid time to all employees of the employer who had a close contact, another definition here, in the workplace, and provide them with the information on benefits. They have added some exceptions here, and the exceptions are employees who are fully vaccinated before the close contact and do not have COVID-19 symptoms. And they also have an exception to COVID-19 cases who return to work and have remained free of COVID-19 symptoms for 90 days after the initial onset of COVID-19 symptoms, or for COVID-19 cases who never developed symptoms for 90 days after the first positive test. And this is due to the natural immunity. So now we go into the section for training. And that training has to be effective. Any information that you provide to your employees, you have to make sure that you customize it. When you develop your COVID-19 program, or when you update your COVID-19 program, make sure that you update it and you customize it to your operations. Once it's customized, then you need to make sure that you provide this information to your employees. You have to train them on how to participate in the identification and evaluation of COVID-19 hazards in the workplace. And this also includes, if you look under the identification and evaluation section, C2A, it says the employer shall allow for employee and authorized employee representatives to participate in the identification and evaluation of COVID-19 hazards. So they have the right to participate. Now you have to also train them. And this is very important. And why is this important? Is because they're out there working, all day. So they could give you very good information as to maybe areas that you have to implement additional controls. You were already required to provide training under benefits, but now they've added to provide training under benefits that are available under legally mandated sick and vacation leave if applicable. So here, please reach out to our sister agency, the Labor Commissioner's Office, Department of Labor Standards Enforcement. And towards the end of the presentation, we'll show you where you could find their contact information. If you need assistance, please reach out to them so you update your policies and procedures and you provide this training to your employees. This section, it's 3205D. This is important because they removed the language that says methods of physical distancing of at least 6 feet and the importance of combining physical distancing with the wearing of face coverings. So they've removed physical distancing, but what they've added is that you have to provide training to the fact that particles containing the virus can travel more than 6 feet, especially indoors. So physical distancing, and this is where they've added face coverings, increased ventilation indoors, and respiratory protection decrease the spread of COVID-19, but are most effective when used in combination. So it's important that you provide training in this area. The next section that they've added is the employer's policies for providing respirators and the right of employees who are not fully vaccinated to request a respirator for voluntary use without fear of retaliation and at no cost to employees. And here, they've also added that whenever respirators are provided for voluntary use, you also have to provide training to employees on how to properly wear the respirator provided and how to perform a seal check according to the manufacturer's instructions each time a respirator is worn, and the fact that facial hair interferes with the seal. So keep this in mind. Make sure you add this to your updated program. And when you're providing the training, that you talk to employees about this, because there's a lot of confusion out there as well. Now, other areas where you need to provide training is information on the employer's COVID-19 policies, which, I mean, that was already required, but now you have to include how to access COVID-19 testing and vaccination. And the fact that vaccination is effective at preventing COVID-19 protection against both transmission and serious illness or death. And there's a whole new section that they've added as well. And this is under section J, and you need to provide training to include the conditions under which face coverings must be worn at the workplace, and that face coverings are additionally recommended outdoors for people who are not fully vaccinated if 6 feet of distance between people cannot be maintained, and employees can request face coverings from the employer at no cost to the employee and can wear them at work regardless of vaccination status without fear of retaliation. And before I move on from the training section, I do want to bring the point across that the training is very important. There's a lot of information out there, but when you do your training, get information from reputable sources. Provide that information to employees. I had an employee that reached out to me and basically said that she couldn't believe that she had to use a face covering during the day. It was in a restaurant. She says, but if I go out to dinner in the evening with my family, I don't have to wear one. So I basically responded and I said, well, yeah, in the evening you're going with your family, but during the day, are you serving more people, more customers? And she says, well, absolutely. And I said, so your exposures are a lot higher. And I said, so you're seeing more people, they're coming in and out. So it's very different. So when she said that, she says, oh, she goes, okay, I get it. I didn't see it that way. So my point here to you is, you know your workplace better than anybody else. So when you're providing training, make sure that you customize it. Make sure you use reputable sources and that you really bring it home to them to the exposures that are there and the reason why you're implementing these controls for their protection. If you want it to be effective, you need to do that. Now, the next area goes into physical distancing. And yes, physical distancing was removed, but also keep in mind that nothing in this emergency temporary standard prevents you from when you're doing your identification and you're implementing your controls. If one of a better control is for physically distancing, hey, why not? Feel free to include that if that's going to protect your employees, because that is your goal, the protection of your employees. And as Dan indicated as well, Under the outbreak section, the regular outbreak section, employers are still required to evaluate whether it's necessary to implement physical distancing and barriers during an outbreak, which is 3 or more in any exposed group, or even under the major outbreak, employers must implement physical distancing and barriers during the major outbreak, which is 20 or more cases. So just don't get rid of that and just use this if it's necessary. So now we're going to go into the next section covers facial coverings, and Dan will be covering the facial coverings.
Thank you, Carmen. So as far as face coverings, people who are fully vaccinated no longer need to wear face coverings, but for workers who are not fully vaccinated, and remember, the fully vaccinated means you've had your single shot Johnson & Johnson and it's been at least 2 weeks, or you've had the second vaccine of a 2-shot series, which is Pfizer or Moderna, and you've had your second dose and it's been at least 2 weeks, and that's when you're considered fully vaccinated. And if you're not fully vaccinated or unvaccinated, the employers are responsible to provide face covers to the unvaccinated workers and ensure they are worn when indoors at all times or when that worker is in a vehicle. It's the employer's responsibility, again, to make sure that they're available and worn properly. If the California Department of Public Health issues some type of order that requires face coverings that is more stringent than Cal OSHA, you're going to have to make sure that you provide face coverings for all of those workers and make sure, again, they're worn. And if you have workers who refuse to wear the face covering, you're probably going to have to go back to your disciplinary procedures, but you definitely want to talk with those workers and train them on why it's so important. The main reason that unvaccinated persons need to continue wearing the face coverings is the CDC guidelines eliminate face coverings, but if you're still maintaining a physical distancing. We completely removed the physical distancing requirement, and because of that, unvaccinated persons or people who are not fully vaccinated have to wear the face coverings because we allow them to be closer than 6 feet to people, and that's why this has been adopted. Again, make sure they're covered over the nose and mouth. Remember, a face shield by itself is not a replacement for a face covering. They can be worn in combination as a face with a face covering for added protection, but just using a face shield is not going to be considered acceptable in lieu of a face covering. Now, there are always some exceptions. These exceptions will apply for all employers and for anyone, for the outbreak sections and for the employer-provided transportation or housing. If a worker is alone in a room or alone in a vehicle, they do not need to wear a face covering. Anyone who is wearing a respirator, where you have a respiratory protection program where respirators are required, they will not need to wear a face covering because the respirator itself acts as the face covering. And we found out recently that originally we were telling employers that respirators with exhalation valves, some N95s come with or without an exhalation valve. Exhalation valves are going to be considered acceptable as a face covering. There's been some studies to show that even with an exhalation valve, they do offer good protection. Now, we also allow people to wear a non-restrictive alternative. And that is for somebody who may have a medical reason, disability, a mental health condition, where they cannot wear the face covering, where it makes breathing difficult, or they have something for some reason that they're not able to wear a face covering. They need to use a non-restrictive alternative, such as a face shield, but a face shield with a drape. And the drape helps keep the gap on the bottom part of the mask sealed to allow those droplets and aerosols coming out of our mouth as we talk or breathe, a place for them to land on and not become airborne. But if you have a worker who cannot wear a face covering, and they cannot wear a non-restrictive alternative, this is where that physical distancing kicks back in. Those workers need to be at least 6 feet apart from all other persons, unless that unmasked person is fully vaccinated or tested at least weekly for COVID-19. As Carmen mentioned, the COVID-19 testing is on company time paid at no cost to the employee. Now, they added this note that you cannot just do testing for these workers as a way to get around the face covering. So you have to use the alternate face covering unless you have a really legitimate reason why a face covering or a non-restrictive alternative cannot be used. You can't just do testing. And again, this part I mentioned earlier basically is saying that when face coverings are not required, employers shall, and shall means you must, provide face coverings to employees upon request, regardless of their vaccination status. They removed the requirements under the engineering control section for fixed work locations. There was always, if you could not maintain a physical distancing requirement, that's when we required an engineering control such as a physical barrier. The clean solid partition that basically was designed to reduce transmission of the droplets and aerosols between your workers. So this section was removed. So you can remove those physical barriers. However, I mentioned a best practice would be to keep them in place, mainly because we still don't know how long the vaccinations are good for, how long they provide immunity. We don't know if we need booster shots yet. And we have the issue of different variants, and that we're still not sure if the variants can, if the vaccinations that we've received are good for the variants. And we don't know that until after a while after the variant's been identified and they do some testing. So it's a good idea as a best practice to keep these. And like I said, you've made the investment. Don't just throw them away, hold on to them, because if you have an outbreak, they're going to be required again. And right now we're in summer, and last summer we were having a lot of cases, but it was under control, and then things got really bad in wintertime. And if that happens again, we can go backwards again with the regulation, and we could see a requirement for the partitions and the physical barriers come back. So I just want to make people aware of that. The cleaning and disinfection thing changed. You'll notice they took out, it says cleaning and disinfection of areas, materials, and equipment used by a COVID-19 case during the high-risk exposure period. Now, basically, it just needs to be cleaned because they've determined that transmission of COVID-19 by contact with surfaces is not as much of a hazard as it was thought of initially. So you just need to clean. But if another worker is going to use that equipment or work in that area or work with the materials within 24 hours, that's when the disinfection part kicks in. And the difference between cleaning and disinfecting, cleaning is just kind of wiping down a surface with some type of, a wet cloth or some type of cleaning agent. Disinfection is designed to kill the virus. And what's very important here when you're talking about disinfection is you have to read the instructions on the disinfectant for the contact time, that product has to be in contact with that particular surface for a certain amount of time for it to be effective. So if you look at something like Lysol, that will say it kills 99.7% of bacteria and viruses within 1 minute. That means that surface has to remain wet for that 1 minute period. So the liquid has contact time to kill the virus. And disinfectant times, the contact time can range anywhere from 15 seconds up to 15 minutes. So it's very important that you read the instructions on the disinfectant if you have to disinfect. And I want to let people know that the EPA has a list of disinfectants that are good for this virus. And that list, if you can do an internet search for EPA List N, as in Nancy. List N is the list of disinfectants, and it includes the contact times on that list. As far as testing of symptomatic employees, again, symptomatic is meaning they have symptoms. So you need to make the testing to those workers at no cost to the workers. They're not fully vaccinated during company time, again, paid time. Remember early on, one of the major changes was somebody who's fully vaccinated without symptoms no longer needs to be tested or quarantined. Again, if you have cases and outbreaks, you still will notify your local health department. And that is a requirement, that's been around since the beginning of the regulation, and that was adopted in California Labor Code. So you need to do that. Now, this is a tricky part. In the reporting, record keeping and access section of the plan, they took out the requirement. They removed the employer shall report immediately to the division. The division is officially Cal-OSHA. Cal-OSHA is part of the Department of Industrial Relations, the Division of Occupational Safety and Health. So when you see anything referring to the division, that is Cal-OSHA. They removed this, reporting immediately to Cal-OSHA any COVID-19 related serious illness or death as defined under Section 330H of an employee occurring in a place of employment or in connection with any employment. Now, the reason this was removed is because it was duplicative. The reporting requirement already exists in other regulations, so they took it out of this one. So just because it was removed doesn't mean you do not have to report these cases. You still will need to report them, but it's under other regulations, Section 342A and 330H. One of those contains the definition of what's reportable and the timeframes. One is the definitions, and the other one provides you the information on what needs to be provided. And it's important to note that report immediately means within 8 hours of knowledge. And if you do not report this to Cal-OSHA, to the local enforcement office, the legislature many years ago mandated a $5,000 minimum penalty for not reporting a serious injury or illness. So if you're in doubt, make a phone call to the local enforcement office, and their phones are answered 24 hours a day. Again, the exclusion, employers shall exclude from the workplace employees who had close contact until the return to work requirements are met. So they just kind of clarified that. Again, the exemption is going to be someone who's fully vaccinated before the close contact and they didn't develop symptoms. People, and this is where they've taken into account some of the natural immunity. If you've had COVID-19 cases, a person who's had COVID-19 and they've gone through the illness, they've met the requirements to return to work, and for the first 90 days after this initial onset of the symptoms, they don't have to be excluded. Unless they, again, if they have symptoms. This is taking into account they have some natural immunity and they can continue to test positive for up to 90 days after they've had the disease. And then for workers who tested positive for COVID-19 but never developed symptoms, they can also continue to test positive for up to 90 days. So for those people, if they do not have symptoms, they don't have to be excluded because they have false positives and that natural immunity. Part of the exclusion requirements, a lot of it is still the same. They added, earnings, wages, seniority, they added the word wages, and they basically say the wages due under the subsection are subject to existing wage payment obligations and must be paid at the employee's regular rate of pay no later than the regular pay date for the pay period in which the employee is excluded. And they're saying that unpaid wages owed under this subsection are subject to enforcement through procedures available in existing law. So Cal-OSHA can cite it, and we have a sister agency, the Division of Labor Standards Enforcement, also known as the Labor Commissioner's Office. They're the ones who really, workers can file a complaint for not receiving wages. So they are often the agency that we will refer people to if they do not receive their wages. And there are some exceptions to the pay, and you need to let your workers know why it was denied and the applicable exception. And one of the exceptions, big exception is going to be where the employee receives disability payments or was covered under workers' compensation and receives temporary disability. So that would exclude them from the pay requirements of the regulation. Now, the return to work requirements, this very minor change here. They added 104, they added degrees Fahrenheit. So we know we're talking Fahrenheit. Someone that has 100 degrees Celsius wouldn't be living because that's boiling point. But what they did do is add this word "and." It was implied before that before returning to work, you had to meet all three of these requirements, and they added the word "and" to make sure it's very clear that workers have to meet all three of these requirements before they can return to work. Persons who have had close contact can return to work if they've had a close contact but never developed symptoms. They still need to be out 10 days. And this change was because the original COVID-19 regulations originally said 14 days, but a governor executive order reduced that to 10 days. So this was, added for the 10-day instead of the 14-day. And that persons who had a close contact can return to work unless all of the following are true: that they've taken a PCR COVID-19 test after the onset of symptoms, and at least 10 days have passed since the last known contact, and they've been symptom-free for at least 24 hours without using fever reduction medication. So again, it's still that 10-day period. However, there are certain industries that if you have critical staffing shortages, those workers can return after day 7 if they've received a negative PCR test from a sample collected after day 5. But this does not apply to all industries. It applies to healthcare workers who did not develop COVID-19 symptoms, emergency response workers without symptoms, and again, this is very specific, social service workers who did not develop symptoms, who work face-to-face with clients in child welfare or assisted living. So not all social service workers will qualify under this. It's specific to child welfare and people who work with assisted living. So now we're going to get into minor outbreak, and I'm going to turn it back over to Carmen.
Thank you, Dan. So now we're going to go into the outbreak section, and we're going to start with 3205.1. And here, this section applies to a workplace covered by 3205 if 3 or more employee COVID-19 cases within an exposed group visited the workplace during the high-risk exposure period anytime during a 14-day period. And again, we have some definitions here. And this section shall apply until there's no new COVID-19 cases detected in the exposed group for a 14-day period. Now, what we have under testing, again, the COVID-19 testing has to be available at no cost to its employees within the exposed group during employees' paid time. And then we have some exceptions. And the exceptions are employees who were not present at the workplace during the relevant 14-day period. Again, this is why it's important to know who's coming in and out of your workplace and where people are going, even within the different departments. And what they've added also is the exception for employees who were fully vaccinated before Section 3205.1 became applicable to the workplace and who do not have COVID-19 symptoms. Another exception is for COVID-19 cases who did not develop COVID-19 symptoms after returning to work. No testing is required for 90 days after the initial onset. or for COVID-19 cases who never developed symptoms 90 days after the first positive test. And this is due to the natural immunity, which Dan talked about. After the first 2 COVID-19 tests, employers shall make COVID-19 testing available once a week at no cost during paid time to all employees in the exposed group. So clarification was provided here. They removed the exclusion section under outbreak, and the reason they removed this is because it's already covered under 3205. Then we go into controls, and under controls, the employer shall continue to comply with all provisions and should also employees in the exposed group shall wear face coverings when indoors or when outdoors and less than 6 feet from another person, unless one of the exceptions applies. So here's where we're talking about the physical distancing. Employers shall give notice to employees in the exposed group of their right to request a respirator for voluntary use if they are not fully vaccinated, and this was discussed under face coverings as well. Employers shall evaluate whether to implement physical distancing of at least 6 feet between persons, or where 6 feet of physical distancing is not feasible, the use of cleanable solid partitions of sufficient size to reduce COVID-19 transmission. So this is the area where we're talking about don't get rid of those barriers just yet. Hopefully you don't fall into one of these outbreak settings, but in the event you already have this available. So this is where physical distancing and the barriers are still in this regulation. You still have to do the investigation, but you have to do a review and a hazard correction. So the employer shall implement changes to reduce the transmission of COVID-19 based on the investigation and review. And here is where you're going to consider moving indoor tasks outdoors or having them performed remotely. So this information was, prior to this, was in the general area under the physical distancing. So now once you do your investigation and you're trying to determine, okay, what controls should I be implementing to reduce the transmission? If you could move some of those indoor tasks outdoors, that would be great, or have them performed remotely. We know it's not always possible. When that's not the case, then maybe consider increasing outdoor air supply when work is done indoors. And again, look at that the guidance from the California Department of Public Health, also to look into improving air filtrations here, where you're going to have that communication with your HVAC person or building owner to determine what type of system, what could you do to improve the air filtration. Also consider increased physical distancing as much as feasible. They've added that. And then require respiratory protection in compliance with Section 5144 and any other applicable controls. And Dan did talk about the respiratory protection, and that's why there's the mention of the N95s, and you have to have them available in the event that an employee requests it. Now, what they've done here as well under this regular outbreak section, they've removed here in buildings or structures with mechanical ventilation, employers shall filter recirculated air with MERV 13 or higher efficiency filters if compatible with your existing ventilation system. This section was, before last Thursday, it was in the major outbreak section. Now they've moved it from the major outbreak section to the regular outbreak section. If MERV 13 or higher filters are not compatible with the ventilation system, employers shall use filters with the highest compatible filtering efficiency, or evaluate any portable or mounted HEPA filtration units or other air cleaning systems that would reduce the risk of transmission, and if so, implement their use to the degree feasible. And notifications to the local health department, this was removed, and this was removed because it's already required under the regular section in 3205. And now we're going to go into major outbreaks, and major outbreaks is similar to the regular outbreak, but this section applies when you have 20 or more employee COVID-19 cases in an exposed group that visited the workplace during the high-risk exposure period within a 30-day period. So this is 20 or more employee COVID-19 cases within a 30-day period. This section continues to apply until there are fewer than 3 COVID-19 cases detected in the exposed group for a 14-day period. Testing, employers shall continue to comply with the testing requirement as described in the regular outbreak section, and it shall be made available to all employees in the exposed group regardless of vaccination status, and it's twice a week or more frequently if recommended by the local health department. Exclusion section, again, this was removed since it's already covered under 3205. Investigation workplace COVID-19, same thing, removed. And then the requirements. So in addition to the requirements of 3205 and the requirements under the regular outbreak section, the employer needs to take the following actions. And here the employer shall provide a respirator for voluntary use in compliance with subsection 5144C2 to employees in the exposed group, and shall determine the need for a respiratory protection program or changes to an existing respiratory protection program under section 5144 to address COVID-19 hazards. And make sure that you provide the training for respirators as well. And in addition to the requirements under the regular regulation and the outbreak, employers shall take the following actions. And here under controls, any employees in the exposed group who are not wearing respirators required by the employer and used in compliance with section 5144 shall be separated from other persons by at least 6 feet, except where an employer can demonstrate that 6 feet of separation is not feasible, and except for momentary exposure while persons are in movement. So here's where physical distancing again is required. Methods of physical distancing include telework or other remote work arrangements, reducing the number of persons in an area at one time. So maybe you may have to change the start time, staggered work shifts, maybe have people instead of starting at 7, everybody starting at 7, maybe some at 7, others at 7:15 or 7:30. That way their start time, their lunch hour, their break hours, those are staggered as well. And everybody's not, all at one place at one time. And this includes any visitors. Also use visual cues such as signs and floor markings to indicate where employees and others should be located or their direction and path of travel, which is one of the, what we were seeing a lot prior to last week. And we still see it now where you go to the bank and you're waiting outside because only a certain number of employees are going to be inside. Staggered arrival, departure, work and break times, which we talked about, adjusting the work process or procedures, such as reducing production speed to allow greater distance between employees, maybe even starting a second shift if that's needed, or another shift if that's needed. When it is not feasible to maintain a distance of at least 6 feet, individuals shall be separated as far apart as feasible. In addition to the requirements, also at workstations where an employee in the exposed group is assigned to work for an extended period of time, such as cash registers, desks, any production line stations, then you have to do the physical distance requirements. And if you can't maintain that, then you have to install the partitions. So again, here, have those partitions available in the event that you need them to reduce the transmission between employee and other persons. Notifications to the local health department, these were also removed because it's already addressed in other sections of 3205. And now we have COVID-19 prevention and employer-provided housing, and Dan will be discussing this.
All right, thank you, Carmen. So I'm going to talk about now employer-provided housing, and I'm just going to quickly go over this section because it doesn't apply to a lot of places. This basically will apply to any place where employers provide housing. This includes typically construction, agriculture, some food processing where there's a lot of seasonal work. It can apply to construction where people have been on, or companies working on a job that's kind of far away from their headquarters and are putting workers up in a hotel or some other type of housing. It does not apply to employer-provided housing used to house the COVID-19 cases, or if a housing unit houses only one person. And it does not apply where all residents are fully vaccinated. Basically, this regulation talks about kind of looking at creating cohorts or groups of people so they live together and work together. So they're kind of exposed to the same people during their off hours as the same group of people they are working with. The physical distancing requirement has been removed because, again, that was removed from the main regulation, so it was removed here. For ventilation in housing units, again, it's what we talked about earlier, maximize the quantity of air, increase the filters to a level that's compatible with your system. If you cannot use a MERV 13 or higher filter, you might have to use or obtain a portable or mounted high efficiency particulate air filtration unit, one of those high efficiency portable filters in sleeping areas if you have 2 or more residents who are not fully vaccinated. So maximize the ventilation for dilution, install a higher level filter that will help capture the droplets and aerosols. And if you have 2 or more residents who are not fully vaccinated and you're not able to get to a MERV 13 or higher filter, or if you do not have a mechanical ventilation system, you're going to have to look at the portable units. The cleaning of the units, again, you want to clean and disinfect after a COVID-19 case was present. If there will be another resident in that area within 24 hours, you don't want to share any unwashed dishes, glasses, utensils, cooking items, things like that, because that's a way of transmitting the disease. As far as COVID-19 testing of residents who have had close contact to a person with COVID-19 symptoms, the frequency is going to be based on the local health department requirements, because in housing, they are not on company time, so the health department will have more jurisdiction over that. And then again, if you have people who tested positive or having symptoms or have had a close contact, then they're going to need to quarantine. And the quarantine is going to be including private bathroom and sleeping areas, so they are, again, quarantined away from other workers. And the one important thing to remember if you're providing housing, don't forget these people still need to eat, and you do not necessarily want the person with symptoms going into the area where people might be preparing food if you have a common area like that. So make sure that these workers somehow still get fed. Again, there's exceptions, again, for people who are fully vaccinated. And again, if they have no COVID-19 symptoms, but they have had COVID before, or they tested positive for the 90-day period after that, those people do not need to be excluded. I'm going to let Carmen take over the transportation part. Again, this section used to say to and from work, which implied it was for those employers that provided transportation from the housing to the job site. It now will include all employer provided transportation. So if they pick up a company vehicle and they work as a group, such as like plumbers or electricians, and they go from job site to job site to job site in the same day, this will apply. So Carmen, go ahead.
Thank you, Dan. So now with employer provided transportation, and this we were getting many questions because, as Dan indicated, they removed the to and from work. So that made it confusing. Now they've provided some clarification under the scope. So now this section applies to employer provided motor vehicle transportation, which is any transportation of an employee during the course and scope of employment, including transportation to and from different workplaces, job sites, delivery sites, building stores, facilities, and agricultural fields, provided, arranged for, or secured by an employer. So this is under the scope. We do have some exceptions, and some of the exceptions that were added are that it doesn't apply if the driver is alone in the vehicle. And it does not apply to employees with occupational exposure that fall under the 5199, the aerosol transmissible disease standard. And it also does not apply to vehicles in which all employees are fully vaccinated. And it does not apply to public transportation. Now, under assignment of transportation, they've added language: to the extent feasible, employers shall reduce exposure to COVID-19 hazards by assigning employees sharing vehicles to distinct groups and ensuring that each group remains separate from other such groups during transportation during work activities and in employer-provided housing. So this is the cohorts that Dan was talking about. They're already, working together or living together. So that's the assignment under transportation. Now, physical distancing, this has been completely removed. Now, under the face coverings, or really prior to last Thursday, this was physical distancing and face coverings. Now they've changed it and it's face coverings and respirators. And upon request, employers shall provide respirators for voluntary use in compliance with Section 5144C2 to all employees in the vehicle who are not fully vaccinated.
Carmen, before you go on, let me just talk real fast about voluntary use of N95s because we didn't really address it yet.
Mm-hmm.
If you're using respirators such as an N95 with a filtering face piece voluntarily, there's very little you have to do. You have to provide workers with the basic information that's included in Appendix D, as in David, of Section 5144. And the information in Appendix D basically states that the dust mask respirator does not provide oxygen. It's not to be used in an oxygen deficient environment. It's designed for particulates or solid materials that gases and vapors are going to go right through that respirator, and that you should follow the manufacturer's instructions. Now, every manufacturer is going to tell you if you're going to wear the respirator, you should be clean shaven. Now, for voluntary use, federal OSHA has a letter saying you do not need to be clean shaven if wearing on a voluntary basis. But because we're trying to filter out these droplets and aerosols in the air that are very small, if you have a worker that has facial hair and put the N95 over that, the air is going to take the path of least resistance. And a person's whiskers do not offer the same filtering as the N95. So while they can still wear it, it's allowed. We really encourage for the best fit and for it to work properly, there really should be no facial hair that interferes with the mask to face seal. And when you're using an N95 on a voluntary basis, there is no fit testing, there is no medical evaluation, there is no written program. Now, if you use an elastomeric respirator, one of the softer rubbery material ones with cartridges, those are allowed to be used on a voluntary basis, but then you're going to have to implement part of a written respiratory protection program that includes the medical evaluation and training on the use and limitations and how to care and store of that N9 or the elastomeric respirator. So the N95s, just a copy of Appendix D and basic training. And I would recommend having your workers sign something that they received a copy of Appendix D.
Okay, so moving on with cleaning and disinfecting under this section, all high contact surfaces used by passengers and drivers, they still have to be cleaned to prevent the spread of COVID-19. But what they have added is they must be cleaned and disinfected if used by a COVID-19 case during the high-risk exposure period when the surface will be used by another employee or driver within 24 hours of the COVID-19 case. So similar to 3205, where it talked about cleaning and disinfecting, and then covered the difference between cleaning and disinfecting. Under ventilation, what they've done here is they removed the degrees and basically added that windows do not have to be kept open if one or more of the following conditions exist. And this is that the vehicle has a functioning air conditioning in use and excessive outdoor heat would create a hazard to employees. Prior to this, it said if the outside temperature is greater than 90 degrees Fahrenheit. So now it's basically excessive outdoor heat would create a hazard to employees. Same with colds. Before it said if the outside temperature is less than 60 degrees Fahrenheit. Now it says the vehicle has a functioning heating in use and excessive outdoor cold would create a hazard to employees. And the reason here is because you have to do that hazard assessment, and you have to, look at what are the exposures and implement controls to remove employees from these exposures. So, and we've had heat waves in the last couple of weeks, so we have to be very careful with that. But that's under the ventilation portion of it. Now we're going to go into frequently asked questions, and Dan will be covering this section.
All right, thanks, Carmen. So again, we have the list. This link is to the revised FAQ document. And again, the original FAQs based on the November 30th version were updated to reflect the recent changes as well. So these are the questions that are posted on our FAQ page. And it basically, the first question, are all physical distancing requirements in the proposed or in the revised regulation gone? And the answer to that is yes, although there are those few exceptions, mainly for outbreaks. And if you have a worker that is unable to wear an unvaccinated or a non-fully vaccinated person who's unable to wear a face covering or an alternative, that they would need to physically distance. Now, the obligation is to provide a respirator that any unvaccinated person who's working with other people or in a vehicle with other people can ask for one, and that has to be provided to that worker. And again, if there's a major outbreak, they are provided to workers in that exposed group for voluntary use. So they need to be made available. Now, upon request, this is a tricky part. Right now, this regulation kicked in on the 17th. So we're almost 2 weeks away from the adoption, from the date this was implemented. So you're in the time period, you need to order these N95 respirators. So if you didn't have them already in stock, you should be polling your workers right away to determine how many people think they want to wear an N95, and take into account the number of people who may want to wear them, and then how often they need to be changed. So you order enough respirators and then have a system to maintain a proper inventory. So you have the proper size and type to fulfill foreseeable quantities. And while most N95s are one size fits all, not one size fits all. So you might need to try get a couple different brands to make sure that, some N95s work better for people with a smaller face and others work better for persons with a larger face. You might have to try some different brands. If more than one employee requests respirators and you run out, OSHA will not cite an employer who makes a good faith estimate. And if you run out and you've already reordered them and you have a receipt showing you have reordered them, that's the good faith effort. If you're out of stock and workers say, oh, they haven't had them in stock for weeks, so we've been telling them about that they've been out of stock, that is not a good faith effort. So you need to be proactive on checking your inventory and trying to keep the supply up to date. We have a list of vendors that actually state they have at least 100,000 N95s in stock and are able to fill those orders immediately. Unfortunately, that's hidden under our wildfire smoke page, not under the COVID-19 information. So this is the link to find some sources of N95s, and I'll show this to you when we look at our website. I've already kind of covered this question, is why unvaccinated persons are required to wear face coverings or respirators. And that's mainly because we removed the physical distancing requirement. And really, a respirator offers much better protection than a face covering. The face coverings initially are designed to protect as a source control, to protect the people working around the person who's wearing the covering, even though they do offer some protection to the person wearing the face covering. A respirator is designed to protect the person who's wearing it because it fits tighter against the person's face. There actually might be more comfortable for people to wear because it doesn't fit tight against the person's nose and mouth. However, because they're designed to filter out really small particles, they are a little harder to breathe through. So you have to take a look and see if, people need to try them and see if they're able to wear them. But the reason they're required to be available is because we removed the physical distancing requirement. The face coverings, again, have to be used by unvaccinated workers or workers who are not fully vaccinated when they're indoors or in a vehicle. And like I said, unfortunately, that's the way the regulation was written and adopted. So even if somebody thinks they have natural immunity by having had COVID before, that was not taken into account in the adoption of this regulation. If you're unvaccinated for whatever reason, you have to wear a face covering when indoors or in a vehicle with other people. So the fully vaccinated workers, they're required for a fully vaccinated person to work without a face covering indoors. You need to document that the workers are vaccinated. And I mentioned earlier that we're going to talk about how you would get that documentation. First off, again, it's legal to ask vaccination status. It's not a HIPAA violation because you're not asking for any type of medical diagnosis or treatment. This is something that's given as a prophylactic, and the federal government has determined that it's illegal to ask workers this question. And how you would document vaccination, number one is you can ask for your workers to provide proof that they bring in their vaccination card or some type of document showing that they've received the vaccination or vaccinations for a 2-dose series, and you make a copy of that documentation. So you have a piece of paper showing that person's who's been vaccinated. You can ask workers to provide the proof that you can see, and then you can just keep a log of that information that you don't have to make a copy. You can make a spreadsheet and document who's shown you the information, or you can allow employees to self-attest that they basically tell you that they have been vaccinated, and then you keep track of who's told you they've been vaccinated. You can use any or all three of these, but you do have to find out who's vaccinated and who's unvaccinated and who's not fully vaccinated. The other question we're receiving a lot is, while you want to maintain this information confidential, the workers' supervisors are going to need to know this information because ultimately they're the ones responsible for enforcing that their workers wear the face coverings. So you don't want to go around posting the information for everyone to see who's vaccinated and not, but supervisors need to know which of their employees are unvaccinated or not fully vaccinated to ensure that they're wearing their face coverings. And if a worker declines to state, if they're not going to provide you a copy, show you a copy, or they're not going to tell you if they've been vaccinated, that worker is going to be treated as an unvaccinated person. They will have to wear the face covering or N95 in the workplace. Now, you have to treat that person as any other worker, and you cannot discipline them or take discriminatory action against that employee, but you have to make sure that they're aware that they're going to have to comply with the Cal OSHA requirements. You just blame us for this, and that if they're not wearing it, that you can get cited for that. And you might, if they do not want to do this, again, I would definitely talk with an attorney first, and then, or an HR professional, and then start your disciplinary procedures under your injury and illness prevention program. And there is one of our FAQs is about issuing citations who do not implement all of the provisions of this new ETS immediately. And again, as long as you're making a good faith effort, Cal OSHA is not going to cite you for this. For example, we know that the sample written program came out within the last 2 hours. So we wouldn't expect an employer to necessarily have an updated written program until we've provided the sample. as long as you ordered your N95s or your face coverings for the unvaccinated workers, you've made a good faith effort. So they're not going to cite you as long as you've made a good faith effort. Now, eventually, this is going to, it'll go away. We know this got posted today, and maybe within a few weeks, they'll start citing employers who have not updated or developed a written COVID-19 prevention program. And again, in a few weeks, they might start citing employers who have not provided respirators, who haven't even ordered any. If you ordered them and they're on backstock, that's all you can do. You've made your good faith effort. So initially, they're not going to cite employers, but they will eventually. I want to let you know that give you these couple links. One is to the Cal OSHA. This is specifically a link to our coronavirus page, and I'm going to show you this in a minute. This is Cal OSHA's main website, and I'm going to show you this as well. But the two blue boxes on the page are where the good sources of information. The upper blue box is the COVID-19 information, and the wildfire smoke page, where you're going to find the list of vendors who have N95s. And the lower box is a list of companies that have been cited by Cal OSHA for COVID-19 related violations. And there was legislation that required Cal OSHA to post this information on our website. And just real fast before I go to our website, both Carmen and I are from the consultation part of Cal OSHA. We are not enforcement, we're a separate branch. We have to be invited to a facility where enforcement shows up unannounced. We work with employers proactively to help them with their safety program and explain to them what's required and what's needed. If you have your programs in place, we'll review them to make sure you have everything you need. We do a talk with you about your injury history to try and, if you to look for trends and try and reduce those types of injuries. It's a free service. There are no citations or penalties. Our funding comes from federal tax dollars and from workers' comp premiums. We get a certain number of cents per $100 in workers' comp premiums to fund the OSHA program. We do not share information with enforcement. We do not share that information, with one exception, and that is if we find serious or imminent hazards and a company absolutely refuses to correct them, we are obligated by federal policies to refer that company to enforcement. And for that to happen is extremely rare. And the other thing we do is all of our consultants have an office duty day. And if you have questions, give us a call and ask to speak with one of the consultants who can answer your question directly. Our consultants were funded to perform field work, but we also provide the service of answering questions by phone. If you're concerned about us having your phone number, because most of our phones now have caller ID, block your phone number. We don't care who we're talking to. We will answer your question. We want to get you the answers and the proper information. If there are serious or imminent hazards identified during an on-site consultation, we give you timeframes to get those hazards corrected. We can give extensions to those timeframes as long as you're making, again, you're proactively working on correcting the hazards and making sure your workers are staying safe during the interim time period. There needs to be employee involvement in the consultations. We talk with your workers to see what they know about your safety program and how effective training is. And if we find serious hazards, you need to post those. And you can twist that around to the positive, saying, we want to make sure you have a safe work environment. We invited Cal OSHA to our facility. This is a list of the hazards they found. We're going to fix them. And this is what you need to do to stay safe until the hazard's corrected. We have 7 offices throughout the state, 4 in Southern California, 4 in Northern California. And if you have operations outside of California, every US state and territory has a free consultation service available. So with that, I want to quickly show Cal OSHA's website. One thing real fast, I want to go to our standards board page, because this question's come up a lot. The regulations themselves, because this is an emergency standard, you would go down here to emergency, here's the COVID stuff. People are asking when this regulation expires. And this original regulation expired October 2nd. Then they updated this regulation with a readoption, and the new expiration date is January 14th of 2022. So this regulation that was adopted on June 17th will be enforceable through January 14th of 2022. At that point, we have one more opportunity to readopt it, where there might be some additional changes, which would then extend the date. And also in the meantime, OSHA theoretically can be working on a permanent regulation for adoption. But right now, January 4th is the expiration date. But also on this page, you will find, this is the link to the regulation that I'm going to send to everyone, and where you can see the strike through versus underline. Now let's go back to OSHA's main page. Right here is our the COVID-19 information. In here, we've got 6 boxes. The first one I think is the most important. This has a link to the regulations, and right now these links will take you to the standards board page to see that document that I just showed you. Eventually, this will take you to Title 8, and you will be able to see each individual one of these sections individually without having to scroll through a 30-page document. This is the old version of the regulation. Here is our FAQ documents in English and Spanish. Here's the original one. Here's the revised one. We have various fact sheets. Here's the sample written program updated today. So here it is in English and Spanish, and then along with some other resources. The second blue box on the COVID page is industry guidance. And again, as a good example, as a manufacturing facility, we have guidance documents for manufacturing. If you click on that, it'll take you down here to some of the manufacturing information. Some of it will have documentation specifically from OSHA, and then we have other information from the governor's office, California Department of Public Health, and from other government agencies. But just be aware, when you look at guidance by industry, manufacturing referred you to logistics and warehousing. But don't forget, you also have office workers. So you might want to look at this office workspace document for additional guidance to protect your office workers. That may not be included in this other industry specific information. The third link for FAQs, we have the regular FAQs are here, but then we have some other FAQ documents on some of the other COVID requirements, such as, AB 685 and safe reopening FAQs. Those are found on this page. We have some other educational materials, including videos and posters and model programs on this page. We've got our webinars here, and we've got our OSHA Training Academy. On the wildfire smoke page, right here is the list of vendors. So we have about 30 vendors that claim to have at least 100,000 N95s available. If you shop at one of these vendors, it's by no means an endorsement. But if you find one of these vendors is out of stock, you can email Eric Berg, who maintains this list, and that company will come off this list. We try and keep it up to date. It was updated last week on June 23rd. This is the link to the cited regulations. The first 5 columns are sortable. First one by date, company name, industry code, what triggered the inspection, whether it was a fatality, a complaint, a referral, the city of the inspection, and the last few columns are not sortable. The violations, the number of violations, the proposed penalties, and this hyperlink right here will take you actually to the citations. So this company, DPDW Inc., in Hemet was inspected between December 1st and June 30th, which means this was after the adoption date of the COVID-19 regulations. So down here, they got cited with a general citation, COVID-19 prevention, section 3205, and they got cited for not having anything in writing. They didn't have an effective written COVID-19 prevention program. They got cited $560 for that. The next citation was classified as serious, also part of the COVID-19 regulation. And it is saying that the workers were not separated by at least 6 feet between other persons and or physical barriers where, a cleanable solid partition was not installed. They got cited $8,435 for that. The third citation also is serious, also COVID-19 prevention, for not enforcing face coverings, the face covering requirements, and they got cited a little over $5,000 for that. So all of this information is public information, and for most industries, I recommend sorting by industry. Scroll through and see if you can find an industry similar to yours, and you will see what Cal OSHA has cited. The other page I want to show quickly is the Department of Fair Employment and Housing. And on their page, on this part here that keeps rotating, if you click on the fourth one, the COVID-19 resources, they've got this employment FAQ English poster. And on this poster gives you information on what type of questions you can ask workers who call in sick, what you should do. Can you send an employee home if they have symptoms, stuff like that. Addresses some protected, job protected leave, how to address people with disabilities or vulnerable population. But the important part that was recently added is for vaccinations. Can an employer require its employees to be vaccinated? And basically, it says, yes, you can require vaccinations. But you do have to make reasonable accommodations for workers with disabilities or for workers that have a sincerely held religious belief or practice. And it also addresses here that if you send people out for, people have been vaccinated outside of your facility by a third party, can you require them to provide proof of vaccination? And the answer is yes. So that, our requirement that says you need to document this is backed up by the California Department of Fair Employment and Housing and the federal EEOC. And this is where you're going to find that documentation. So with that, I want to thank everyone for attending today. I hope you got some useful information out of it. I don't know if all of the questions were answered, but if not, what we're going to do is we print all the questions afterwards or download the questions. And if the question was not answered, and if you did not ask the question anonymously, we will be able to reply to your email with an answer to your question. So with that, thank you for attending and be safe. And if you have questions or are interested in on-site consultation, please call one of our consultation offices and talk with one of our consultants. Thank you.